In conjunction with the international patient safety standards set by the Joint Commission International, whom we've been accredited by, we at Apollo Hospitals Bangalore Operation Theatre follow the WHO surgical safety checklist. As soon as the patient is wheeled into the operation theatre and prior to anesthetizing the patient, we do a sign-in to confirm the patient's identity, the site of procedure and the site of procedure. This would help in preventing wrong site, wrong side and wrong patient surgery. This is usually done by the anesthesiologist. It is read out loud, and the surgeon, the circulating nurse and the scrub nurse, including the patient because the patient is awake, are participating in this confirmatory checklist. It is also checked if the patient has any allergies, if the patient has any difficulty in airway, any problems with blood loss and if blood has been arranged, and if all the required equipments and medications are ready for the surgery to start with. After this checklist is done, the patient is anesthetized, and once the patient is draped and the patient is ready for the incision to be put, the surgeon reads out loud the timeout, wherein we are again cross-checking and reconfirming the patient's identity, the procedure, the site, and we are also reconfirming a few other things like if the antibiotic has been given, the appropriate antibiotic has been given, any thromboembolism prophylaxis has been given. The surgeon also reiterates if there is any expected critical events during the procedure, any blood loss has been anticipated, if so has it been arranged, and once this is confirmed, the surgery begins. Once the surgical procedure is over and finished, again the circulating nurse reads out the sign out just to reconfirm the procedure which has to be recorded, and the surgeon okays that. Any the instruments, sponge and the needle counts are rechecked and completely confirmed by the circulating nurse with the surgeon. The surgeon also gets an okay with the name and site of all the procedure and the specimens, investigations to be sent for. Lastly, any equipment related problems are also addressed in the sign out. And finally, before the patient is woken up, it's confirmed that all the people present for the procedure are okay with whatever has happened and there's no questions. By following the above WHO surgical safety checklist, we at Apollo Hospitals Operation Theatre have ensured that we are operating on the right patient, doing the right surgery on the right side.